Hi, everyone. We are going to wait another 2 minutes just to let everyone join and get settled in. So we will get started in just a few moments. For those of you just joining, we are waiting 1 more minute for everyone to get settled in, and then we'll get started. All right. Hi, everyone, and welcome to another Rethink webinar. My name is Erin Mayberry, and I am Director of Community Engagement here at Rethink. I want to thank you all for taking your time to join us today. Just to give you a little bit of background about Rethink, if you are not familiar with it, we are a behavioral health software solution. So we have clinical practice management, training, and billing solutions for behavioral health providers. And one of the assessments that we have that is exclusive to Rethink is our medical necessity assessment. This allows a clinician to complete an assessment that will assist them in recommending appropriate ABA dosages for their clients when they are submitting to a funding source. And today's webinar is all about best practices with using the medical necessity assessment. We are joined today by Marin Jacobson, and Marin is one of the many Vcbas at ABS Kids. ABS Kids is a provider that serves clients and families affected by the autism spectrum disorder in home clinic and community-based locations and settings. They are based in California, Utah, Tennessee, and North Carolina. And ABS Kids was an early adopter of the Rethink Medical Necessity Assessment. Their clinicians have been utilizing the medical necessity tool since the beginning of 2020. For the past 2.5 years, they've completed approximately 8,000 assessments across over 200 clinicians. So they have a lot of great preliminary data and outcomes that they're going to be talking about and sharing today. So I want to introduce Marin. She is a board certified behavior analyst and oversees the clinical operations and is a regional director at ABS Kids. She's worked in the field of ABA since 2004, using a variety of strategies to teach new skills to children, caregivers, and providers. And she has supported upcoming Vcba candidates through supervision, as well as teaching coursework at National University. So welcome, Marin, and thanks for joining us today. A few housekeeping items that I want to just get through quickly before we get started. We are going to just be having an open dialogue for the first part of our webinar today, but we do encourage everyone in the audience to ask questions. So if you look in your GoToWebinar pane, there should be a questions area. You will be muted for this presentation, but please feel free to type in questions in that questions pane. And at the end of our presentation, we will address as many of those questions as we have time to get to today. This webinar is being recorded, so you will receive a copy of that recording via email in the next few days, and it will also be posted to our blog on the Rethink website, so you can access it there as well. Before we start, I also have a poll question, and we have a few poll questions that we're going to be asking the audience throughout. So I'm going to launch that for just a few moments. If you can take a look and answer that, we would really appreciate it. The first question is, what process does your organization have for recommending ABA dosages for clients currently? And I'll leave that open for maybe 30 seconds or so, and then we'll share the results and we'll get started. All right, thank you for those of you who answered that. So it looks like a variety of responses here. Some people are already using Rethink's M&A tool. Some people have their own process and their organization has process. Looks like a lot of people are kind of doing this on their own. So I really want to start by talking about how the medical necessity assessment can really assist in this process. So Maren, I think maybe the first question for you is, what was your process and what were your clinicians doing prior to using the M&A for recommending ABA dosages when they were submitting to paying sources?
It's a great question. We were, a little bit of a mixed bag in terms of, deferring to the clinicians who were carrying out the assessments if they had the experience level to make those recommendations. We were relying a lot on, that judgment that they had as an individual clinician to just determine what was best for the child. But I think as we grew our Vcba team, we recognized that as new Vcbas came in, they didn't have that experience, and they also didn't receive that training as part of their certification process and in being in coursework. And so, it did have an impact overall on what we were seeing with recommendations being more subject to conversations like patient availability or even payer restrictions of what we were actually clinically recommending as Vcbas. And so our process prior to M&A, we tried really hard to review those recommendations, but I found it very challenging to review every one and to be able to give consistent insight into whether or not the recommendation being made was appropriate prior to having just a standardized tool that we could line up that recommendation against and see if we were close to, an agreement there. And with the hours being such an important part of the efficacy of ABA, I think it did present challenges to, how much progress we could make with patients if we were way far off the mark based off of those conversations with families about their availability or, other limitations that we really needed to find a way to work through in order to give the best care to patients. So, that process that we had before, I think in a lot of ways we're just a lot more aligned now that we have that standardized method for recommending those hours.
And I think a lot of people in our audience can relate to that. It looks like close to 50% of you said that each clinician is responsible for kind of determining how to recommend those ABA dosages. And as I'm sure we all know, approximately half of BCBAs are really new to the field, right? Less than a few years experience. So like you said, we're not all getting formal education opportunities in being able to do that. So can you maybe talk a little bit about how you guys at ABS Kids initially trained staff to use the tool, and then maybe speak to, with that first kind of rollout, how did you manage to do that across all of your locations? You guys are a relatively large provider group.
Yes, absolutely. I can speak to that. So today, ABS Kids, the M&A training is a standard part of our new BCBA training as we promote internally from people who have passed their BCBA exam. And also as we onboard externally, everybody receives the same training on how to use the tool as part of the assessment process. We are running other assessments, and the M&A is just part of that package that we provide to each patient as they come through our initial intake process and as we reassess at the 6-month period for reauthorization. And so, we felt like it's very important all BCBAs got the same training so that we were implementing the tool with the highest level of fidelity and understanding within the organization of how it needs to be run. And so, that's our process for new people joining our organization. When we rolled out the tool in 2020, we'd actually started training at the end of 2019. And I do think that was a larger task, being able to address where we had kind of had this void before in how we were recommending hours, not really having a standard process. For some, that was super well received, that we were giving them this resource and this tool. And then, of course, others, had a process that worked really well for them and they felt like was getting them to the decision that they needed prior to the M&A tool. So getting everybody aligned and on the same page of why we need that tool and why we need to implement it as part of our assessment. It's not the entire assessment, it's where we come up with the initial hours that are needed to address the deficits that we need to work on for each child. And so, getting everybody aligned, this big culture shift and in full transparency, I think if you're looking to adopt something like the M&A tool, being prepared with knowing you're going to have to really answer everybody's questions and make sure that they understand, how it's meant to be used and how it's meant to be combined with other skills assessments like the VB-MAP or the PEAK assessment, along with, parent questionnaires and parent interview. And, there's a lot of components to the assessment that we use outside of the M&A. The M&A is the only assessment that actually gives us an hour amount that we can start working on. Is that going to be something that we're going to be able to schedule with the family? Is that something we're going to be able to get approved through the insurance? But it's a great starting point for us in terms of the amount of hours. And that's really what we, tried to highlight for our existing team members when we were going through the training process and the initial adoption process. We also internally have a process where we have the M&A recommendation, and then we have what the Vcba is recommending, and we compare those two. And if there's a large difference, we talk through that and why that might be, and what factors are contributing to that discrepancy, and are those factors appropriate for reducing the amount of care. And that process, I think, came from a lot of feedback that we received from our BCBAs and from our clinical teams, that sometimes the 40 hours a week just isn't going to work for the family, and that child still needs care. And so how can we do our best to provide the appropriate amount of intensity that's going to get that child to make progress, while also, factoring in these concerns that the family has, or that the BCBA has about, providing a full intensive treatment or a certain amount of treatment for the child. So I know that's a long-winded answer to say, how have we trained? But we've taken for our existing team, we've taken a lot of their feedback to heart and developed a lot of campaigns. We're actually doing an M&A in May right now on our virtual office that has been utilized to kind of showcase these positive experiences that BCBAs have had with their patients. And we've had RBTs weigh in too about, how they've seen their patients directly benefit from having more therapy during the week, or, having the appropriate amount of therapy during the week. And, being able to share those successes and also share the barriers to reaching prescription, so that we can help each other work through that and identify, is this really an issue of whether it's wrong or right for the patient, or is it more an issue of the culture of, understanding how ABA works and what's appropriate for the child. So we've done a lot of that campaigning. We've done a lot of that support for our team as we've kind of shifted to using this tool, because it is a big change for BCBAs who are used to coming up with these recommendations without use of the tool.
I think you guys have done a great job with the change management, it sounds like, and really getting feedback not only from the clinicians, but from really everyone on the team with the outcomes that you guys have seen so far. I also wanted to highlight something you've mentioned a couple of times, is that this is part of your process, right? So it's not intended to discount the clinician's recommendation. It's intended to actually assist them in being able to make sure that their recommendation is aligning with best practices. We have another poll that I want to share. So if you'll take a moment to respond to this. On average, currently, about how much time do you or your organization spend training staff to recommend ABA dosages for clients? So I'll leave that open for just another 30 seconds or so, if you can kindly respond. All right, thanks for everyone who responded. It looks like a majority of you are not currently spending a lot of time training staff, maybe 1 to 2 hours or less or no hours. So I want to kind of talk, Marin, you mentioned a lot of how you're training, and it sounds like this could be very time consuming, but really it doesn't have to be, right? How long are you guys typically spending on this?
Yeah, so I'd say, the initial training on the M&A tool is just a few hours during, just a couple of hours during the initial process for onboarding a new Vcba, where I think there is more, the tool itself is very user-friendly, I should say. It's very straightforward, definitely takes less time to fill out than a lot of our skills-based assessments that we're doing. And the really nice thing that we've discovered is, we can incorporate in a lot of parent feedback while we're going through that, especially for those initial assessments. It can be incorporated into the parent interview very easily. And then that almost helps to support the recommendation a little bit more too, because we are asking some of these questions directly that we may not have an opportunity to observe during the assessment process. So the training itself is pretty straightforward in terms of use of the tool. Where I think it comes to a higher need for support is really that shift from more of that feeling of, this is what the assessments are telling me, and I'm going to say, 20 hours is appropriate for that child. When we plug that into those same results into the M&A and we get 30 back, that 10-hour difference, and understanding why there's that 10-hour difference and kind of working through that on a case-by-case basis, that's where we were spending more of our support. As an organization, we have gone since 2021 to 2022, we've increased our clinician agreement with the tool, which just means when Vcbas are putting in the information into the M&A tool, they get an option, do you agree or disagree with the recommendation? And then we ask, in the M&A tool, they ask, why do you disagree? So that we can kind of start to get that data through Rethink on why these recommendations might not be in agreement. It's really promising to see that we've gone up 10% in agreement in the last year. So right now, 83% of all of our recommendations through Rethink are agreed upon, which I think means that we're working on that training piece. And, we are seeing some positive gains with Vcbas being more on the same page and understanding how the tool can be a help and a support for the assessment process and for that recommendation process. But I would say overall, the training really does need to be ongoing, especially if you're thinking about making a big shift in your organization with providing this tool. It's super helpful, but it is also, again, it's just a big change from what a lot of us as Vcbas have grown up in the field doing, which is, coming up with our own recommendations based off of skills assessments that don't really tell us that dosage. So yeah, that would be overall training, initial training, super quick, just that support and that ongoing support, making sure that you're ready for that is important.
For those of you who may not be as familiar with the medical necessity assessment, once the assessor completes the tool and answers all the questions, then the tool is going to recommend that total number of hours of direct services per week. But we're also asking that the clinician provide feedback on whether or not they agree with the tool recommendation. And if they do or do not, we ask what they will actually be submitting to their funding source in terms of the number of hours they're recommending, and then providing any additional feedback and comments on any differences in those two recommendations. With the Rethink overall aggregate data, we have over 11,000 assessments completed and about 75% agreement with the tool recommendation and the clinician recommendation. So Marin, you guys have a little bit higher agreement with your clinicians, and I think that speaks really to the time and effort you've put into all of the training and support you're providing to staff. So you did that initial onboarding and training back in 2019, early 2020, and since you have implemented the M&A, are there any changes that you've made to your training process? And if so, can you kind of speak to what those might have been and why you made the changes?
Yes, absolutely. The most notable change that we've made at ABS Kids is we have identified, in large part due to this updated assessment process that we follow, a need for just a focused group of assessors who are highly trained, not only on the M&A, but on any of the assessments that we're going to use to prescribe a treatment plan. And making that shift for us, I think has resulted in higher quality of treatment planning, just more consistent recommendations of hours. And so, we're able to kind of take out more of the subjectivity that could have been applied on a case-by-case basis by having a larger group of Vcbas doing the assessment and making the treatment recommendations. Vcbas still have that clinical ability to modify the treatment plans and, obviously, add prompts and change teaching strategies. But our assessor team is utilizing all of our assessment tools, including the M&A tool, to really prescribe the treatment that child needs. And I think it's just created a more objective process. And then also we are now piloting having our assessor team also do some of those reauthorizations. So they're able to see the same child back in 6 months and look at their progress from a really objective lens. And also every 6 months we rerun the M&A tool. It's really exciting to see those hours go down for kids who are making the appropriate gains and progress that we need to fade treatment. So in terms of training, we train all of our Vcbas, whether they're on the assessor team or not. But we have a big emphasis and a little bit more in-depth training on how to prescribe ABA and how to create treatment plans for our assessor team, just because we feel like that is it's a better level of service for the families and the patients when we're able to kind of have these specialists running that process.
Excellent. I want to shift focus now. We've been talking about kind of how you've implemented, how you've trained, and now I would like to kind of talk about the outcomes you've seen since you've been using the tool. So maybe we can start with the operational outcomes that you've seen since implementing the M&A, and then we'll talk more about the clinical outcomes.
Yes, absolutely. So, from an operational perspective, having more agreement on the ABA dosage definitely helps us with projecting, our hiring and recruiting needs. It helps for us to be able to schedule both families and our RBTs to their, preferred hours and to the child's prescription, which in the end is better for our retention as well if we're able to provide RBTs with more consistency. With the adoption of M&A in 2020, we also shifted to doing block scheduling, and that was definitely more feasible when we had more agreement with the hours between the clinician and the family. And the M&A tool really helped to kind of bridge that gap along with the other assessments that we've been utilizing. You know, I think that those are some major gains operationally for us. You know, in general, we've seen across age groups up to age 9, we've seen an increase of about 10 hours per week prescribed for patients. And, you know, this is all based off of clinical information that we're putting into the M&A tool. And so, you know, obviously before adoption, we didn't really have anything to compare our prescriptions to, but we do feel like, you know, based off of the initial outcome data that we're gathering as an organization on how patient progress has been positively impacted, that there is, you know, a clinical significance to those 10 hours being adjusted across those age groups. And so that's been a big win clinically, to see patients receiving the care that they need. You know, we have a lot of anecdotal, like I mentioned, we're doing the M&A in May on our virtual office. We've got a lot of anecdotal success stories, stories from families who, prior to the M&A tool, we just didn't have as much support for those conversations to getting them to commit to a higher intensity, which was more appropriate for their child. You know, it can be scary when, you know, we're asking for 30 hours a week to go into the home or to have the child come into the center. That's a lot for a kid. And one thing that I really like about the M&A tool and that we've really benefited from is it provides a breakdown of the prescription of how many hours per week we need to be spending in any given area. So, you know, whether that's working on sensory defensiveness or working on communication or working on social skills or life skills, you know, we have a breakdown that can kind of help us to show the family, you know, this is 30 hours, but look how quickly it goes when you're spending 5 hours a week in this area and 5 hours a week in this area. And, you know, I think that parents appreciate that. It's like getting like the school schedule or, you know, the calendar and just kind of seeing like, this is how my child's valuable time is going to be spent. And these are all areas that are important to me. And so we're able to facilitate those conversations with a little bit more support with that breakdown. So that's been really nice as well. I think, you know, in addition to not really being trained on dosage requirements or expectations for patient success in our schoolwork, as BCBAs, I think communication can also be a challenge, especially communicating with caregivers that are still kind of accepting the diagnosis or accepting that their child is in this form of treatment that, you know, is very intensive. And so having any supports at all for communication, I know has been really appreciated by the team and then by the families that we serve.
Yeah, I know we've talked about this in previous discussions, but, you know, a family who may be newly diagnosed and new to ABA, and we're suddenly coming in as clinicians and saying, and we're going to spend 30 hours a week or 40 hours a week with you, and they are completely overwhelmed. So I do think that the tool not only is a good training opportunity for clinicians in how to recommend the hours, but it's also being able to start to talk to stakeholders about that. So to piggyback off that, we actually have a final poll question for everyone in the audience. Do you currently have challenges with communicating dosage recommendations to key stakeholders? So if you will take a moment to answer the last poll, we would appreciate it. All right, thank you for everyone who answered. It looks like we do have quite a few challenges. For those of you who don't have any, maybe we'll have you join the next webinar and explain what you've done to be successful with that. Maren, is there anything that you can tell us about maybe communicating with payors? I know with parents, it's opening up that dialogue and getting them to really start to buy in and even building rapport with a parent coming in as a new team member. But Have you guys found any success with talking to payors as well?
Definitely. I think the same support within the tool is really helpful for them to be able to see the breakdown of the hours. Again, just like for parents, I think for a funding source, the amount of hours can seem like, there's no way that we're going to be able to have, success with working this many hours with a child. But I think it just is another support for communication on the payer end, where we're able to take to them, what that breakdown looks like. We also have the treatment plan in hand too, so they know that it matches up with the areas of priority from the various assessments, including M&A that we're doing. And that just helps to solidify, we do have a plan. We have an intention for all of those hours that we're requesting. I think so far it's just, it's been, case by case where we've been able to be more successful with those conversations, but it is something that we would like to look at more data around of, getting more clinician feedback on, when Vcbs are doing peer reviews, how frequently they're referencing the M&A, or, how they would kind of rate the support of having something like the M&A to fall back on. But I think more than anything, it's given our Vcbs confidence in those conversations, where, they aren't second guessing their own recommendation, because they have, an additional outside tool that they've used that can kind of confirm, this is what the child needs in order to, fill in all of these areas that are showing up as deficits on their assessments. So I think that confidence is really important, especially for our newer BCBAs, and those who are having their first peer reviews. Could be really scary, and I think just having that to fall back on is a really nice support and a really nice just clinical tool for them.
Yeah, those conversations can be difficult just because a lot of times funding sources and clinicians are speaking the same language, but we're speaking it two different ways. So I think that's one of the big goals of the M&A, is to really be able to have this open dialogue and all kind of be on the same page when we are communicating. The final thing I want to ask you before we open it up to questions from the audience is, what recommendations do you have for a company or even just a single clinician who is newly adopting the tool?
Well, that's a really good question. I think just going back to some of my earlier statements, just really preparing for change. If you're thinking of adopting this tool for your organization, having a strategic plan in place that allows for you to plan ahead for the trainings and the support that are going to be required with everyone getting used to using this tool. Like I said, I think that we really saw two groups at ABS Kids: the group of clinicians that were newer and just happy to have a support for making those recommendations, and then maybe some more experienced VCBAs that felt really confident in their recommendation abilities prior to M&A. And so for the organization, just having in mind how you plan to support that. Initial training is awesome, but also having, a list of benefits ready and helping them to understand, how the benefits outweigh, the cons of the situation, that it is a change and that, there is going to be disagreement, but that there is a process in place. That's another thing I'd recommend, is making sure there's a process in place to receive feedback from your team. They can leave it on the tool, which is great as Rethink, evaluates that. But I think internally you also just need that process for discussion in order for people to feel heard and like that they can still have that clinical voice when they're using the tool. And that's the intention, from my perspective too with this tool, is that there's always going to be that discussion that has to take place. It's definitely not like a be all end all, but it also is a really nice way for us to, be able to have a number of hours for that dosage in mind, without just making a sweeping statement that all patients need 40 hours a week or all patients need, X amount of hours per week. We feel like it still allows for individualization. For the individual who's thinking of adopting this tool, I think just the same, knowing that we are a field that is based off of individualized care, and knowing that, as you're adopting this tool, if there are questions or if there's things to clarify with the families, that those are things that you need to be mindful of and incorporate into the recommendation, and that the M&A tool can still be a really great support as you're incorporating things like, is the patient receiving ABA in school, or is the availability a limitation for the recommendation? These are all like good, I think, points in the conversation that we're having with caregivers as we're making that M&A recommendation. And so just being mindful that it is a supportive tool, but there's a lot of other factors that come into play. It helps us to get closer to where we need to be in terms of the dosage, but that it also takes into consideration that the full prescription is not going to be feasible for all families. And I think having that discussion, having that conversation in mind as you're using the tool can be really helpful. We have decided in our organization, that there's a threshold of the prescription that we, are flexible down to. And at that point, we have to have a serious discussion of, is ABA the right treatment for this child if we dip below that threshold? And I think identifying that percentage of the prescription within your own teams or within yourself, if you're an individual using it, is a really good kind of checkpoint to say, okay, well, we're dipping under 80% or 70% of what the M&A tool is saying this child needs. Are we the right treatment? Is it going to be more cumbersome for the family to have half the prescription and less progress than it would be to refer to a different type of provider or service? And so I think these are all just things to kind of keep in mind as you familiarize yourself with the tool and adopt it. We've really enjoyed having it, but I think it is something that is a big shift, and just having that in mind on an individual level and on an organization level is really important as you're going into any adoption, so that you can support that change and make it the most efficient for your team.
Thank you for that. And I know we've already gotten a lot of comments saying thank you for those recommendations. We have some questions that are specific more to some of the things that you've discussed, and then some more generic questions that I am going to address at the end. And again, for everyone in the audience, if you do have questions, please type them into the question pane, and we are going to address as many of those as we can. One, Marin, I think that is directed specifically to what you've been discussing is, this is coming from a new Vcba who's having a hard time getting families to understand the importance of more than a 1 or 2 hour session. So the hours have been authorized, and now they're available for an hour at a time or something like that. So what do you do when families say they don't think their child can handle a longer session? Do you guys have any recommendations for that?
Yeah, that's such a great question. Sorry, I just muted myself again. And that's such a great question, and it definitely comes up, especially I think with our younger patients, and people being new to ABA, and what, like, you're gonna work with my kid for 3 to 4 hours. In those situations, I think it really boils down to the treatment plan and how we're pacing the treatment. This is actually a topic that we had as part of our M&A in May campaign, is how do you pace a longer session and make it successful for the patient and the caregiver as well. I think having a roadmap of this is what the session is going to look like is really helpful for the parent to kind of see, okay, so we're gonna, the first 15 minutes when I get there, I'm just going to be reviewing what we're gonna work on. I'm gonna set up my materials, just breaking it down into more bite-sized pieces for the parent to be able to see, okay, my child is not gonna just be drilled, 3 hours straight on, vocal communication, or, just something that's very exhausting and aversive for the child and for the caregiver. I think also just reassuring. I mean, this is ABS Kids method, but reassuring that we are incorporating a lot of naturalistic teaching method. You know, we definitely don't intend to keep the child at the table for, you know, that entire amount of time, and that we're utilizing some more natural opportunities where the child can contact more naturally occurring reinforcement, and helping the parent to understand that those types of opportunities are what our team members and ourselves, what we're trained to identify and contrive for the child. And so, you know, we're in the home for 3 hours, but some of that can just look like, you know, we're hanging out and walking around the house and like labeling things, and, you know, receptively pointing out, you know, different stimuli that we're working on identifying, and then, you know, having a great time so that that child can learn. And I think that's where sometimes that barrier for those longer sessions takes place, is they might just need that perspective of what does ABA look like, you know, successful ABA look like in those longer sessions, because I do think, you know, we have a lot of examples that people probably go to of like, oh, this is what it's going to look like for 3 hours, is my child's going to sit and do discrete trials for, you know, the whole time. We might do some discrete trials at the table, but we're not going to do that the entire ABA session. So I think really that's kind of our method for addressing that. And again, like I said, the pacing, and you have to work with your RBTs too to make sure that they're holding up their end of that. If you're telling the family this is what it looks like, just making sure that your RBTs have the training too to make those longer sessions successful, because it definitely pays off when they are.
Those are great recommendations, especially, you know, it's not all that tabletop work that we're doing. So it can be fun, engaging, interactive, lots of other things that can be incorporated. There's another question going back to, you had mentioned earlier that assessors can complete this with a parent, and someone asked how long it might take a clinician to complete the M&A with a parent.
Yeah, that's a really good question. You know, I think it definitely depends on, you know, how much detail we're getting from the caregiver. But, you know, I have run the M&A assessment for a patient that I was very familiar with for reauthorization in less than half an hour. And so, you know, with going into an initial assessment, that's obviously going to take longer, and you're getting to know the child. But once you know them, and the reauthorization or the reassessment process is at play, and it's a very quick process. It's really based off of what, you know, the child can do, what you have done in the treatment plan with them already, what skills they've acquired, and so it goes very quickly. But with incorporating the parent interview piece, so we run our initial assessment appointment in office, and so the parent is there, and the assessor will be filling out the M&A assessment as they're running, you know, concurrently some of the skills assessments from the VB-MAP or the PEAK, depending on where we've identified the child needing to be with their skills assessment. And so, you know, that is obvious, that's incorporated into this 2 to 3 hour appointment that they have for that initial assessment. So in terms of a sheer number of minutes, I wouldn't be able to give you a solid answer, but I think as you move on, it goes really quickly, 20, 30 minutes max of doing the reassessment.
And incorporating that into other assessments and working with the caregiver, parent, and child, I think in a lot of ways can be really beneficial for everyone involved.
Right.
Another question about your assessor team that you mentioned. So in those cases, who creates the goals for the client? Is that the assessor team or the supervising Vcba? Can you just give a little bit more clarification on that process for ABS Kids?
Yeah, I'd love to. Our assessor team does create the goals for the patient based off of the assessments that they've carried out. Of course, like I mentioned, you know, in terms of actual targets to prioritize or teaching strategies, the Vcba has the ability to judge that clinically, you know, on what's going to work best for the child and the environment, because they're actually going into the home or seeing the child in the center. But initially, the goals are all set based off of our findings from the initial assessment.
I think the rest of the questions we have so far are things that are a little bit more Rethink focused. I'm going to address these, but again, everyone in the audience, feel free to continue asking questions through the questions pane. The first question is, how do we edit Rethink recommendations for the hours in the split? And right now with the medical necessity tool, the tool is recommending the number of hours total for services per week, and then allocating those hours based on how the assessor is responding to the tool questions. So you can't edit those, but on the assessment results page at the end of the assessment, you do have the opportunity to let Rethink know what you will be recommending as a clinician and whether or not that agrees with the tool recommendation. So we can start to look at the data that you're providing us to continue making improvements to the tool. The next question is basically, how did we develop the tool? What input did we get? And Rethink has a scientific advisory board that is comprised of several professionals, including Vcbas. And we did a lot of research and worked collaboratively with that team to really drive the algorithm for the tool itself. I have one question actually, Maren, that I see a little bit more related to implementation, and you may not be able to answer this. It's more specific to considering like summer hours, but I don't know if you have any situations where the M&A recommendation is adjusted for summer hours because the client is not in school. If you could speak to how you guys do that or not.
Yeah, absolutely. So I think I mentioned earlier in the call that, we take a look at what the Vcba is recommending compared to the M&A, and, we discuss any discrepancy there. So we refer to that, the M&A is always going to be the same. It's whatever the M&A tool tells us. So that stays the same. What the Vcba is recommending, though, that can fluctuate within a certain, percentage that we're comfortable. Like I mentioned, that threshold. For us internally, we've decided, at 70% of the M&A recommendation, that's when we're nervous that we're going to be able to really fulfill our responsibility as BCBAs to, give this child appropriate treatment. And so, it's not to say that we won't have discussions beyond that point. It's just kind of our threshold. We can fluctuate that up and down, as we need to. So if over the summer, the BCBA is saying, I want to get to 100% of the M&A recommendation because the family has the availability, they're willing to do it, we will get as close to that recommendation as we can. Or, even if we want to go over the M&A recommendation, we see that too, where sometimes the disagreement from the BCBA is actually like, I think this child needs more intensive treatment and the insurance will approve it. And so we'll go for it. So I think it's an excellent question, and definitely something that we do at ABS Kids, to help further support progress in other times of the year when they're not as available to reach that full prescription.
Awesome, thank you. A lot of questions have come in that are actually driving me toward the next webinar that we are going to have, and that is scheduled, I believe, 2 weeks from today. So a lot of you have asked, can we get supplemental training? This has been really helpful, but can you show examples? Can I see what the recommended hours look like? Can I get a treatment plan example with the M&A hours recommendations? And the answer to all of those things is yes. I am putting into the chat right now a link to a webinar that we're going to be doing in 2 weeks, kind of as a thank you to all of you who have taken time today to join us and who signed up and attended the webinar. We are doing a follow-up presentation on Thursday, July 9th from 1 to 2 p.m. Eastern, so same time, 2 weeks from now. And in this webinar, we are actually going to walk through completing the medical necessity assessment tool. So I'll demonstrate how to do that for an initial authorization as well as a reauthorization. So then you'll get to see the tool itself in action. You'll get to see some examples of how the results are generated, and you'll have additional opportunities to answer questions. But that will give you a nice overview and a supplemental training for those of you who are Rethink users already into a little bit deeper dive into how the M&A works. So definitely invite you all to join us for that webinar coming up soon. And, you know, we really encourage anyone who is on Rethink but not using the tool to start to consider doing so, because the more providers that we have adopting and utilizing the M&A, the more data that we can gather to further strengthen and calibrate the tool, like I mentioned. And obviously, the stronger the tool becomes, the more effective your clinical outcomes are for your clients, as Maren talked about today. So hope you guys can join us for that webinar. For those of you that have asked in the chat, hope that answers all of your questions. For those of you who do currently use Rethink, if you are wondering where the M&A is located, if you have our clinical package, then you can go into the client area of Rethink. And in your client's profile under the assessment tab, there is an option for the medical necessity assessment. If you do not see that option, just reach out to your customer success manager and they will be able to have that turned on for you. And if you do not know who your customer success manager is, you can email support@rethinkbh.com. I just entered that email into the chat. So if you need any assistance with the M&A tool or just accessing your customer success manager, feel free to reach out to them. We have a couple more minutes, so if you have any last minute questions, feel free to type them into the questions pane. But I do also want to share one more webinar that we are presenting. We've partnered with ABAC. They are putting together live CE events that are geared more toward the multidisciplinary space. So if you currently offer services that go beyond just ABA, or if you're looking to expand your practice, we have a webinar next week on building a collaborative interprofessional team to support inclusive decision-making for teams who support those with ASD and related disorders. I know that's a mouthful, but it is basically supporting inclusive decision-making for multidisciplinary teams. And that is being presented by Dr. Julia Feiberg. That one is next Thursday, June 2nd, and it is actually a 2-hour webinar, so that is from 12 to 2 p.m. Eastern. I'm putting the link into the chat now for that webinar if you are interested in it. And that webinar is going to have CEs. You will receive 2 CEs for attending. And if you use the code Teamwork25 coming into your chat next, you'll receive a 25% discount on the listed price when you sign up. So a couple webinars in that chat. The discount applies to the webinar next week for the multidisciplinary webinar. All of that is going to be in an email that is sent to you following the webinar. So if you don't get it now, that is okay. We will send all of those links to the following webinars as well as the recording from today in that email that you received. Maren, thank you so much for your time. We really appreciate you joining us and appreciate hearing all of the wonderful things that ABS Kids is doing. Thank you all for joining today and hope you have a great rest of your afternoon. Have a good one. Bye, Maren. Bye, everyone.